Depression.
It is a common mental disorder affecting people worldwide, characterized by persistent sadness and a lack of interest in previously enjoyable activities. Clinical depression or major depressive disorder is considered if one presents with symptoms for more than 2 weeks every day. Grades: mild, moderate, severe. According to DSM 5 criteria, one has to present with at least 5 of the 9 symptoms. Types of depression: postpartum depression, seasonal affective disorder, persistent depression, psychotic disorders, disruptive mood dysregulation disorder. It affects close to 350 million people in the world and is the fourth largest cause of disability. Affects 5.8% of men and 9.5% of women worldwide. 1 in 7 Indians were affected by mental disorders, of which 38% is attributed to depression. Susceptible population includes people who underwent traumatic event or have recently lost someone, age, elderly are affected more, sex, females are affected more. Exposure: agents like alcohol or drugs, chronic illnesses, medicines, violence, trauma, and genetics can contribute to depression. Imbalance in neurotransmitters like serotonin or norepinephrine are suspected to play a pathological role in depression. Subsyndromal symptomatic depression indicates that a person's symptoms doesn't quite meet the criteria for clinical depression. So they are usually under the iceberg.
Clinical course of the illness. A 51-year-old lady is brought to the emergency by her husband as she proclaimed that she wanted to kill herself. She has had trouble sleeping for the past 4 weeks. She has been unable to focus on work, has low energy, and has lost weight. The previous example is a typical case and satisfies DSM 4 criteria, but cases can present to an OPD with only somatic symptoms like headache, weight loss, etc. This atypical presentation is also called masked presentation.
Diagnosis of depression can either be done clinically or through questionnaires. Clinically is subjective and unreliable. Structured questionnaires are further divided into self administered questionnaires like patient help questionnaires, and professional interview like Hamilton Depression Grading Scale that are done by a professional. Treatment: pharmacotherapy, psychotherapy, electroconvulsive therapy, family therapy in case of children. Electrotherapy is used in case of treatment failure with medication. With treatment, 70 to 80% of individuals can achieve reduction in symptoms. 20% with the disorder will continue to have the illness even at 1 year. Recurrence is quite common in depression, especially those who develop depression in a very young age, but late onset depression has been associated with longer and severe symptoms. Those with symptoms of psychosis and those who have partial remission have poorer prognosis. Various studies have claimed up to 90% cases of suicide have some form of mental illness. Studies done in India have attributed 25 to 35% of suicides to mood disorders like depression. Primary prevention or universal prevention. It's aimed at improving the overall mental health of a population. Primary prevention advocates for avoidance of alcohol, a healthy active lifestyle with social circles. Secondary prevention. It focuses on individuals and populations which are at higher risk of depression. It is also called selective prevention. Methods employed: screening of high risk populations like elderly, homeless, alcoholics, school programs, positive parents program. Tertiary prevention or relapse prevention. It is used for reducing disability, it enhances rehabilitation and prevents reoccurrence. Using combination of antidepressants and psychotherapy, this can be done. Mental health in India has historically been stigmatized and neglected and had been treated by faith healers instead of psychiatrists. Mental Health Act has had the vision to promote, prevent, protect, enable recovery, destigmatize, and ensure socio-economic inclusion of persons affected by mental illness. Done through accessible, affordable, and quality healthcare and social care to all throughout their lifespan. To deal with the issues of neglect and abuse of the vulnerable, Government of India has been actively employing, training and sensitizing mental health staff in each district. It has been increasing funding and establishing residential continuing care centers throughout India and has been offering support to families. Government of India has introduced a helpline number for mental health. It provides separate ambulance services through the states, actively promotes awareness campaigns and research to destigmatize mental health and to promote mental health within people of India. Comprehensive Mental Health Action Plan 2013 to 2020 emphasizes international attention to mental health and its stigma. Objectives: reinforcing leadership, integration of mental health and social care in communities, implement promotion and prevention policies, using information technology and research to promote health. WHO with its partners called up for a scale up in investment in mental health. World Mental Health Day campaign Move Forward for Mental Health, Let's Invest kicked off recently in 2020.